Hello everyone, welcome back. Today we are going to be finishing the series on hypertension. Today we are going to be talking about hypertension during pregnancy. In this segment, we are going to address three major points. The first point is preeclampsia. The second point is eclampsia. And the third point is HELP syndrome. So stay tuned and let's get started. Alright, welcome back. So, what is preeclampsia? Preeclampsia is also known as toxemia. What is this toxemia? It is hypertension after the first 20 weeks of pregnancy. In other words, after 20 weeks of gestation. When your high blood pressure at this point is very high, right? It's higher than the normal. It's called preeclampsia. Now, what are the risk factors of preeclampsia? There are several risk factors. Number one, preeclampsia is mostly prevalent in people with a family history of preeclampsia, right? And number two, preeclampsia is most common in African American women, especially African American women over the age of 35. So from 35 and above, anyone is susceptible to preeclampsia, but mostly, more so, in African American women from the age of 35 and above. It is also prevalent in people with autoimmune disorders. It is also prevalent in people with kidney diseases. It is also prevalent in obese patients. So if you are obese and you get pregnant, you increase your chances of preeclampsia. So preeclampsia is when your high blood pressure starts from 140/90 and above. So that range is when you can be diagnosed with preeclampsia. But it's not just the level of the blood pressure, it's also signs and symptoms like blurred vision, right? You have blurred vision when you have preeclampsia, you have vomiting, okay? You have swellings of the hands and feet. And when these patients urinate, when they pass urine, there's protein in their urine. So with all this combination of symptoms, including shortness of breath, with all this combination of symptoms, you can successfully say that someone is diagnosed for preeclampsia. Now, what is the treatment? You gotta manage the blood pressure, all right? Your OBG gynecologist has to manage your blood pressure to keep it below 140/90 until the baby is mature enough for delivery. Now, if it gets to a point where the baby cannot stay in there, they're gonna have to deliver the baby. Otherwise, you'll have complications like more liver damage, more kidney damage. You will have blood clotting problems because the clotting factors of the blood is made from the liver. So if the liver is damaged, then the clotting capability of that individual is dysfunctional, all right? The renal dysfunctional even worsens, right? Then you have something known as placenta abruption, right? You have something known as placenta abruption, which means the placenta is detached, right? And the baby is vulnerable at that point. So the baby must be delivered, otherwise the fetus will pass away, the baby will die. So it is critical that if you're pregnant, especially if you're vulnerable with being obese, being an African American, being from age 35 and above, having a family history of an autoimmune disease, and having a history of kidney disease, you are particularly susceptible for preeclampsia. And you want to make sure that you see your OBGYN as often as possible, right? And you listen to instructions because you don't want to jeopardize your health and the life of the baby inside of you, okay? So the next big point I want us to talk about is now eclampsia. So usually patients who have preeclampsia graduates into eclampsia, And what is the difference between preeclampsia and eclampsia? So now eclampsia is when the blood pressure is even higher than 140/90, when the kidney dysfunction is even worse, when there's even more protein in the urine of the patient, right? So the complications in preeclampsia are heightened in eclampsia, right? Which means the situation is getting worse, okay? So you also see more accumulations of fluid in the body, especially in the pulmonary area, in the respiratory area. It's called pulmonary edema, where there is water retention in the lung. But eclampsia only happens in the third trimester of pregnancy, okay? It starts from the third trimester of the pregnancy and then it exceeds forward. So the complications for eclampsia is even way worse, like seizures, because the blood pressure is too high, right? So that can lead to seizure or even coma. And if the mother is this sick, it's very damaging, it's very detrimental to the fetus. So at this point, if they cannot keep the fetus in the mother any longer, they have to deliver the baby. The baby must be delivered. Otherwise, we're going to lose the baby, okay? But we would also try to manage the seizure with a medication known as magnesium sulfate, okay? You will try as much as possible to continue to lower the blood pressure. You will try as much as possible to continue to rid the body of the fluid retention. You will try as much as possible to make sure that the kidneys are functioning properly so that the patient is not losing a lot of protein. But then the fluid retention is because the patient is losing protein in the urine. So if these things cannot be managed any longer, then the baby must be delivered, okay? Otherwise, it would result to fetal death, all right? So the third major point that I want us to cover is something known as the HELLP syndrome. What is the HELLP syndrome? About 5 to 8% of women who are pregnant end up with HELLP syndrome. Now, the interesting thing about this syndrome is that it could either happen at the tail end of gestation, of pregnancy, or shortly after delivery. So that's the interesting part about this. So you must not only be pregnant to have the symptoms, it could happen right after birth, all right? So you want to still make sure that you're visiting with your OBG gynecologist just to make sure that you are being checked. And also there's something known as, just off tangent, there's something known as the postpartum blues. So it's when you feel depressed and having the new baby makes you anxious and all these things. You can even have your hair fall out and all. So you just want to make certain that you're on the same page with the doctor. You're reporting every changes that you're feeling in your body, including the psychological changes, right? It's critical that you mention all these things to your physician, all right? To your OBG gynecology rather. So you mention all these things. Now, so HELLP syndrome, it develops, right? It develops right before 37 weeks of gestation, or it could even occur immediately after birth, okay? Now, what is this? What is HELLP syndrome? What are the risk factors for HELLP syndrome? HELLP syndrome is highly probable in patients with a history of preeclampsia during pregnancy. So if after the first 20 weeks of gestation, you were diagnosed with preeclampsia, you have to be monitored very closely, especially after birth, because if you don't have it occur during pregnancy, you have to be monitored after pregnancy, because then you're liable, you're very vulnerable for the HELLP syndrome, okay, right after birth. So patients with a history of preeclampsia, again, African American patients are susceptible to HELLP syndrome, okay? Obese patients, and patients with diabetes. I want to digress here a little bit. If you want to get pregnant, if you are planning to get pregnant and you're obese, I would strongly recommend that you lose weight before getting pregnant, because the weight into pregnancy, obesity into pregnancy, really increases your chances of a complicated pregnancy, okay? So you want to make sure that if you're overweight, if you're obese, right? If you're obese, you have to lose weight before you get pregnant, because you are going to gain weight again. during pregnancy. It's just you have to. If you don't gain weight during pregnancy, or you gain only a small amount of weight, then that's not healthy for the fetus. But you have to gain a substantial amount of weight during pregnancy, okay? It's expected. So I'm going to dissect obesity next, but you have to make certain that if you plan on getting pregnant and you are obese, or you have diabetes mellitus, you want to make sure that you have these conditions under control. If you have kidney problems, you want to make certain that you have this problem under control. If you have hypertension, even before pregnancy, you have to make certain that it is all taken care of before you get pregnant. Otherwise, you would have a complicated pregnancy, which could even lead to a miscarriage or premature birth, which is not healthy for the baby, right? Nor is it healthy for you. So you have to make certain that you prepare yourself for pregnancy so that you have a smooth pregnancy process, you have a smooth delivery, the mother is healthy, the baby is healthy, okay? So this is the 3 major points I wanted to cover on hypertension during pregnancy. So we talked, let me brief recap. We talked about hypertension during pregnancy. It comprises of preeclampsia, eclampsia, and HELP syndrome. And the risk factors are similar. African American, obese patients, diabetes mellitus patients, and women from the age of 35 and older are particularly susceptible. And people with pre-existing conditions like autoimmune disorders. So you want to make sure that you have these conditions in check before you take in, right? Before you conceive. All right. So this brings us to the end of our hypertension series. I hope this helps. Please leave your questions at the bottom, and please do not forget to subscribe. Please do not forget to subscribe and turn on your notification buttons or bells so that you get the videos as they come out. Thank you for watching. Have a wonderful day.